Hello, my name is Hannah Brown, and this is my Case Study 3 video for SBCE 638. Topics to be covered within this PowerPoint include the client background, target behavior, interventions, as well as the application and procedures of these interventions. I will be going over the client background as to give a background of understanding on why we are performing these interventions. My client's name is John Doe. He is 8 years and 9 months old. He has a diagnosis of autism spectrum disorder with an accompanying language impairment, and his behaviors of concern, as reported by his caregiver, include tantrums, which include kicking, screaming, biting, throwing, and aggression. The client has significant impairments in communication, independent and safety skills, maladaptive behaviors, and social interactions. Other services utilized include speech therapy and occupational therapy, and he was previously enrolled in Early Steps. Assessment results and ABC logs have determined that the client's function of behavior is tangible and escape. If we operationally define the behavior is tantrum, any instance for a minimum of duration of 15 seconds in which the client engages two or more behaviors: screaming at a volume that can be heard at 10 feet or more away, making contact with others with an open or closed fist, making contact with others using his feet, making contact with others' skin using teeth, and throwing objects in a way in which they land 1 foot or more away. Interventions implemented include functional communication training, visual schedules, and we have recently added token boards. So let's begin with talking about functional communication training. First, we want to identify interfering behavior, which for our client is screaming and hitting with an open hand. Then we want to determine the function, which for our client is escape, but primarily access. What is an alternative form of communication for our client? For my particular client, he does have the ability to form short sounds, so we chose verbal approximations. And while at home, before attending therapy, the client began writing to his mom what he was wanting. So we do incorporate that if a verbal approximation is not able to be achieved. When implementing functional communication training, the technician or parent should have access to and control over preferred items. We do not want to grant the client free access to these items, as we want them to appropriately ask for them. We are going to use a prompt hierarchy using the most restrictive fate to the least to teach replacement behavior. This is going to encourage the client to quickly learn how to use the verbal approximations in writing instead of the hitting and the screaming behaviors. When the client begins consistently utilizing functional communication methods, we can begin thinning the reinforcement, which involves slowly increasing the time between an appropriate command, whether that be a verbal approximation or writing, and access to a break or the item of choice. We then need to calculate procedural fidelity in IOA. So first we want to develop a checklist of components, steps, and protocol required to implement functional communication training. We then want to observe the technician or the parent implementing the procedures. We want to analyze all steps to determine if being correctly implemented. Then we can use the equation located at the bottom, which is total correct components implemented over total components implemented, and multiply that by 100. And this will give us a percentage of total correct components implemented. We will now begin discussing visual schedule. So first we want to identify what visual cues will be needed and in what form, images or words, and determine how it will be carried or what location it will be. For my client in particular, he has a booklet which includes images that can be utilized within the school setting, the home setting, as well as the therapy setting. We will determine the method of manipulation, such as placing it in finished category versus check marks. For my client, he places his in a finished category. When utilizing visual schedules, you want to use short and concise language when instructing the client and prompting, short and sweet. Assist the client during transitions and prompt the use of the schedule, such as carrying it with them to different locations and settings. We want to be consistent with reinforcement and correction. Consistency is always key. When calculating fidelity in IOA, we want to develop a checklist of components, steps, and protocol required to implement visual schedule. We want to observe the registered behavioral technician or the parents and the procedures implemented and analyze these steps to determine if they are being correctly performed. This includes following the checklist, ensuring and prompting the client to move it to the finished category, etc. We're going to use the equation located at the bottom, total correct components implemented over total components implemented, multiplying that by 100 to get a percentage of the total correct components implemented. We will now begin discussing token ports. We want to identify what visual cues will be utilized, and these can be individualized to the client's preference. This includes stickers, stars. My client is currently working with a token board with his favorite cartoon characters located on it. We want to determine a schedule of reinforcement, and this needs to be appropriate and individualized to the client. We need to determine backup reinforcers in which the client will be working for. Currently, my client works for cars and trains. However, this may change, which is why a preference assessment is always important. We want to use short and concise language when instructing the client and prompting, and be consistent in quickly reinforcing appropriate behaviors. This at times depends on what the schedule of reinforcement is, but depending on what that is, we need to quickly reinforce appropriate behaviors. When calculating fidelity in IOA, we need to develop a checklist of components, steps, and protocol required to implement the token board for that specific client. We want to observe procedures implemented and analyze the steps if they're being correctly performed by the parents and or the registered behavioral technician. Again, we are going to use the equation located below, total correct components implemented over total components implemented, and multiply that by 100 to get a percentage of the total correct components implemented. Located here are my references utilized throughout this PowerPoint. I would like to thank you for watching my video, and if you have any comments or questions, please feel free to reach out to me.